Hi, my name is Kevin Reiter. I'm a physician with Northwell Health, GoHealth Urgent Care. And today the topic is the risks of using antibiotics when they may not be appropriate. Now, we all know that antibiotics are a really important tool in our arsenal when it comes to preventing and treating infections in patients. But what are the risks of using those antibiotics when they may not be needed? So a couple of inherent risks to any medication is side effects. So some of the common side effects that we see with antibiotics could include things like stomach, GI upset. For females, it could include things like yeast infections. There's a condition in the medical world known as C. diff or Clostridium difficile. This is a bacterial overgrowth that can occur in the colon of patients when they use antibiotics. When the normal flora is altered, this bacteria called C. diff can overgrow, and it can lead to a condition called colitis or C. diff colitis. Now, this condition over time has become inherently difficult and a challenge to treat because it becomes resistant to some of the medications that we use. And another problem from that, this condition can lead to surgeries, can lead to removal of portions of the colon and things like colostomies for patients. So it's a big risk, and it's a risk that we see more and more of because of the inappropriate use of antibiotics. Another possible risk are medication interactions. Antibiotics in and of themselves have their own potential interactions with medications that a patient may already be taking. For example, patients who take certain cholesterol medications or certain medications for behavioral issues, taking an antibiotic may prolong something called a QT interval. So by doing so, can lead to things like fatal arrhythmias and in rare instances, even sudden cardiac death. So clearly a side effect or an adverse effect that's avoidable in instances when we use antibiotics appropriately. Another potential risk is allergies. We know that antibiotics can cause allergies or allergic reactions. Certain classes of antibiotics are more likely to cause allergies than others. And one severe form of allergic reaction is something called Stevens-Johnson syndrome. So when a patient develops Stevens-Johnson syndrome, they can actually end up admitted to a hospital. They can end up admitted to an intensive care unit. It's such a severe reaction that it can lead to a significant amount of morbidity and potentially even mortality in patients that are using antibiotics. And the more inappropriately we use these antibiotics, the more chance there is for exposure or risk for these types of reactions. It's important to understand that antibiotics have their place, but I think it's also important for providers, especially in the urgent care world where we see a lot of acute visits for respiratory infections, that we're using antibiotics appropriately. So some inappropriate uses for antibiotics in our field, in the urgent care world, are things like acute respiratory tract infections, which we know to be viral, acute bronchitis in someone who does not suffer from underlying chronic debilitating lung problems, a pharyngitis, which is not streptococcal in origin, a mild sinusitis, which will either self-resolve if it is bacterial, however, overwhelming majority of time is known to be a viral infection. These are some of those instances where antibiotics have no use, and inappropriately prescribing antibiotics is what potentially sets a patient up to have these interactions. And I think the last and probably the most important factor that we talk about when we discuss the inappropriate use of antibiotics or using them in instances where they may not be needed is the development of resistance. So what is antibiotic resistance? Basically, over repeated exposures to antibiotics, bacteria become intelligent and they develop ways to modify themselves so that the antibiotic no longer works for them. They have ways of altering their own genetic DNA so that antibiotics no longer work the way that they would normally work in that situation. A couple of examples of these resistant antibiotic bacteria is MRSA, or a bacteria known as methicillin-resistant Staph aureus. This is a staphylococcal bacteria that over time and after repeated exposure to methicillin or penicillin antibiotics has developed resistance, and now that family of antibiotics can no longer be used. Another example of a resistant bacteria that's developed resistance over time is something called VRE, or vancomycin-resistant enterococcus. Again, as the name implies, this is an enterococcus bacteria that over time has developed resistance to a common antibiotic known as vancomycin. Another example of this is something called ESBL, or extended spectrum beta-lactam. This is a group of E. coli bacteria that over time have developed resistance genes to antibiotics in the beta-lactam family. So that requires providers to go to the next level of antibiotics, and then potentially the next level of antibiotics to treat these infections, which again sets patients up for more potential exposure to antibiotics, which again leads to more potential instances where the bacteria can develop resistance to antibiotics. Now, an interesting statistic that came out recently, just this past week actually, from a UN report, stated that by 2050, there could be 10 million deaths a year related to bacteria that are resistant to the current antibiotics that we have. Now, in the urgent care world and in the medical world in general, we have an everyday opportunity to help prevent this from happening. So by using antibiotics appropriately and in situations that require antibiotics, by following the guidelines, by using evidence-based medicine, we have an opportunity and a chance to really help mitigate these numbers, and they're pretty astounding numbers. So as a medical community, we need to all come together, especially in the urgent care world, and make sure we're all fighting for the same cause and having these discussions with our patients on a daily basis. And again, my name is Kevin Reiter. GoHealth Urgent Care. Have a good day.